Hi, how are we doing? What's the energy level? This is like the ninth inning or the last mile of the century ride or the marathon or the triathlon. So I'm not going to make you do exercises like Dr. Sanjay did. And you're not going to get away with doing nothing because it's an experience, right? So thank you. Thank you for having me. Asheville is near and dear to my heart. How many people are local? Anyone? A couple? Western North Carolina local? North Carolina local? Yay, it's North Carolina Integrative Medical Society, right? How many people not from North Carolina? South Carolina? Close, right? We're all in this little southern space together, aren't we? I grew up in Connecticut, so you're not going to hear the southern voice out of me. But I've lived in Charlotte. How many Charlotteans in there? I see you. I've seen you. Yes. I lived in Charlotte for 26 years. So literally just over half my life. So I guess technically I'm from here. So today I'm excited because, like Dr. Sanjay, I get to reveal this is my first talk to a medical provider, integrative, anything besides one-on-one with providers on this topic of, let's just call it next gen, next level compounding. When I say compounding, because I come from the pharmacy background, you'll learn a little bit about me in this presentation because we learn through story, don't we? So you're going to learn a little bit about my story today. I do walk, so you're going to have to track me because I'm going to walk over here and give this side of the room a little more love than they got today. And I'm going to keep walking because I walk and I talk. It's just easier for me. So forgive me if I'm making you dizzy, okay? But let's get settled. Let's get grounded. I know it's the end of the day, so I'm not going to put you in a meditative state out in the void and get you sleepy. But what I want you to do is get receptive to information. We've been in high beta a lot today, beta brainwave activities, because we've been paying attention to a lot of information. Dr. Tracy said it, right? We're in information overload, and this is the end of the day. So believe it or not, this might seem complex to you guys, but I'm making it really simple for you so you don't have to sit on this brain. So what I want you guys to do is do your best. There's no judgment in this room. And you're going to hear me say that word a lot, and. Because it's not or, it's and. And we can't listen and pay attention and receive new information while we're doing something else. I've been practicing this philosophy of kind, not nice lately. And when you think about it, you can always be kind. Kind means heart open. We're receptive to new information when our heart is open. When it's closed, we don't really receive information. So just put your feet on the ground. That's grounding. Let's put away our electronics, our little dopamine hits, just for a moment. If you feel that's where you need to be today, that's fine. What I am fearful of, or maybe not fearful, what I don't want is for one word or one sentence that I say that could turn your trajectory around in your business life, whatever, because you missed it. And that's okay, because you're here, right now, exactly the way you're supposed to be. So let's just do a small centering exercise. Let's put our feet on the ground. Let's get our back straight. Let's close our eyes if that's comfortable for you. And I just want you to take one nice, deep, diaphragmatic breath, almost like you're breathing through your hips. Just breathe in nice and slow. Whatever's normal for you, a little slower than normal. Hold it at the top for a moment. Notice that moment, and then exhale and relax. We're all integrative here, so we can do this, right? Breathe in through the belly. Hold at the top for just a moment and relax. We're stimulating that vagus nerve. We're getting into a receptive mode because we're just allowing ourselves to get in that parasympathetic rest, digest, repair state. This is also the state where your heart will open because we want you to receive this information not from your head, but in your heart. Because a lot of stuff I might say today might be a little over the top because there's some science in there. So let's just take one last deep breath in. And you're letting it out. Let it out with a little hum or a little sigh. Feel a little better, right? A little easier to receive some information. Not from here only. We're all analytical here. We're all practitioners of some fun science that has to do with integrative health. Integrative health means you're doing many different things. There's not one way. So I want you to just simply be curious. When you might have heard some of this, you might have not. But what we're at today is we're doing precision medicine. We're talking about that all day today. We're all integrative in this room. And this precision integrative approach means technology is now meeting bio-individual needs. So tech has finally caught up to what the body does. We're going to talk about this with BHRT, TRT especially, because that's what I specialize in, and compounding. And our focus is on the delivery of this integrative approach. So I promise to give you my best today. Do you promise to give me your best today? So we can learn and grow together, because what I'm going to prepare for you, this is the culmination of my life's work. And it's not broken, but it's certainly not complete. So before we get to completion, we're going to have to integrate this knowledge. This is beautiful synergy, right? So I'm going to tell you a little bit about me, so you just know who this crazy guy in the room is talking about. I'm a pharmacist. I spent over 35 years in that career because I started in the back of a pharmacy when I was 16 years old. At that same time, I also had and developed leukemia. So I'm a cancer survivor who turned a pharmacist. That's what got me into medicine. How many of you got into healthcare because you wanted to help other people? That was like the main driver. And a lot of us integrative functional providers, how many of you got through school, got into the day-to-day and started learning that you actually can't take care of them the way you felt like you wanted to when you got? I see a lot of bobbleheads in the room, right? That's why we've gone down, let's call it the light path. So that's kind of me. I was a pharmacist because I wanted to help cure people. I wanted to help other people because medication, I don't call them medicine anymore. Medication fixed me. That's what I thought. And through this journey that I've taken, I've realized over the time that most chronic conditions aren't healed with medication, right? We all know this in this room. I don't have to spend all of my energy, which I've been doing for the last 10 years in pharmacy rooms, to explain to people. Can you imagine me in a room of 100, 200 pharmacists trying to explain to them that drugs don't manage chronic disease the way you thought they did? So I've been kind of labeled in the pharmacy world as the wellness guy who happens to be a pharmacist. So this room makes me feel very comfortable. You're my people. I live in Charlotte. I'm an NCIMS member, and you're all integrative. Your mind is open. So let's open it further. How about that? So I've done compounding for about 20 years, clinical nutrition for about the same. I'm a jack of all trades as it relates to health, wellness, and well-being. I kind of tell people now I'm a pharmacist turned healer. Does anyone identify with being a healer in the room? Not many, right? Well, here's the question I'm going to ask you now. How many of you have successfully got someone off a medication due to an intervention in lifestyle or integrative health? I consider all of you healers, because that's what we do. When we make a medication unnecessary, what have we really done? We've healed. We've told the body it can do what it does. So I'm going to tell you a little bit about my journey in that today. So I went down the path of functional medicine, that little thing on the back of my name. I'm an IFMCP. I'm a certified practitioner as a pharmacist. Just to give you guys clarity, any pharmacists in the room? 1, 2, 3. Yeah, you're my people. I don't really identify as these things. These are the things we use as tools to help people. But I was the 9th pharmacist in the world certified in IFM's approach. That means I was in the other category going through this process. They wouldn't even identify me as a guy in the room that should be there. It's kind of, you think about it, we're told in pharmacy school, this is what we taught, drugs and disease states. Here's the disease, here's the drug. Here's the pill for the ill from the very beginning of my training. So you can imagine we weren't really in the field of integrative functional medicine health, but here I am talking to you because my journey never stopped. And it didn't stop because, well, why am I in the room? I'm talking about nanoemulsions, compounding, and functional health, BHRT. Well, I've studied all 3 of those. Nanoemulsions, is anyone doing liposomals in their liposomal glutathione, liposomal? Okay, so you guys understand the word liposomal. This is basically what we're going to talk about as it relates to hormonal balancing and actually going down the road of peptides. I've also gone down the healing side of health. Let's call it woo. Anybody speak woo in the room? Come on, raise your hands. Who's highly spiritual in this room? I didn't say religious. We're not going to go down that path. There's something bigger than us, than what we're doing. Do you believe that everything's connected? All right, well, here's the spoiler out of your, I'm going to give you the result of this whole talk. Science and spirit are the same thing. They're just spoken in different ways. Just like quantum physics, there's a particle and a wave. They exist simultaneously. It's just how we look at them. Yes? Any quantum physics geeks in the room? Cool. So I found this guy called Joe Dispenza. Anybody know who he is? Same people, right? Dr. Joe Dispenza kind of blends science and spirituality. He says, science is simply the contemporary language of the mystical. Look, germ theory was pretty mystical back in the archaic days, right? It's now science. We know Newtonian physics is real. I drop this, it goes here, right? But we also know quantum physics is real. So they exist at the same time. So I'm going to start. I speak woo and I speak science, but I speak them most often in the same wavelength. So that's what I say. Take what you hear and whatever resonates with you, take that home with you. If whatever doesn't resonate, don't worry about it. Just leave it aside. It's okay. I'm going to speak both languages today because I think it's important for what I believe the future of medicine is. I'm going to ask you, you can even write it down. What's beyond integrative and functional medicine? Is it quantum medicine? I think you probably think so. Is it light medicine? Is it energy medicine? All of it's real, guys. You can't see energy, but it's certainly real. We talked about mitochondrial function as energy in the body, but what is it really? It's fueling your batteries. So I've had the privilege of studying directly under Dr. Joe and directly under Alberto Villota. So yeah, we got some of my peoples in the room, okay? But blending the two together at the same time is what we're going to start working on as it relates to the profession of moving from well care to true healing. Does everyone believe that the body can heal itself? We just don't know how all it mechanistically works. That will start to evolve in the age of information, AI, and all these other things. But do we all understand too that humanity is changing? Do we all feel that the world is changing at some weird rapid pace that my body doesn't know how to understand all the time. We talked a lot about the word stress today, didn't we? Did we connect all those dots with pediatric care with Dr. Temple and cardiovascular care with Dr. Sanjay and Dr. Tracy? We all talked about what are we doing with the model of stress? Well, it's been a big part of my life, which is why I think it's been a big part of my awareness of understanding how the body can become dysfunctional and create disease just by thought alone. We know that our mind can make us sick. We also know that our mind can make us well. We're all somewhat clinicians in here, right? Has anyone heard of this thing called the placebo effect? I think so, right? No hand raised up. Wait a second here. No. We've all heard it, right? But what is it? What's your definition of the placebo effect? In one sentence.
No medication, no active something to let the person or patient think that they're utilizing something.
Okay. What's your definition? Putting the front row on the spot.
So placebo is when we see the results based on no actual substance or information, and yet our mind can.
So pharma wanted us to think double-blind, placebo-controlled studies. Show me the studies, right? Pharma wants to say, so the placebo effect is pretty simple. People get better off nothing, or they get better off thought alone, right? We think it's like, or it's, well, there's science to that. We're bringing this to the table, and I want you guys to understand this, not because you're going to get it here, just feel it. Because if we could teach the body how to heal itself and nurture our patients, our clients better, that's how we deprescribe medicine. We go out of business in one way, so we can go into business another way, because we want to teach people how to do that. So I speak woo, I speak science, I speak clinical nutrition, compounding, pharmacy, and functional medicine. That's why I'm in this room talking about this concept. I kind of a unicorn in that space. In my clinic, I use body, mind, and energetics, but I can also do my intake with patients. I too spend 90 minutes first off with my patients, because what happens? More often than not, we talked about it a little bit today. My patient was heard for the first time in their whole sick care journey. So I got a compounding pharmacy. I have a wellness center. They're kind of building and growing as we go up together, because I released the retail pharmacy business about a year ago, which is a big shift for me. And it was about a 7-year cycle for me to let go of. And I'm so glad I did, because now I can do fun stuff like this. And I run a podcast called Beyond the Pills, and that's my happy place. That's what regenerates me, because I have really good conversations with people all over the world that merge ancient wisdom and modern science for true healing in their way. There isn't one way. So take what you want, throw the rest out. Just take what you want, okay? So I'm going to get through the boring stuff, and I'm going to go really quickly, because I don't love law. But since there's only like 2 or 3 other pharmacists in the room, I got to give you some information about compounding, so you guys can make your lives easier when you need to prescribe it. And for sure, my life easier, because I don't have to call you to get all these little things done before it actually becomes a bona fide prescription. So there's a lot going on in the regulatory landscape, especially as it relates to peptides. Is anybody like clicking their Claude or AI every so often, and it changes almost rapidly? So I'm not going to actually talk to you today about which peptide for this, which can do that, because it literally is changing so rapidly. But what I can do at the end of this, there's a way to connect with me, and I can give you that information so you don't have to search it, okay? But this regulatory piece, I want you to be clear, because if you understand this model, the what and the why, your how becomes easier. BHRT prescribers in here? A lot of you? Of course, right? So we're shifting towards highly restricted stuff like peptides. Peptides aren't a drug. The FDA doesn't know how to regulate it yet. They're little peptides. You know what a peptide is? It's 1 to 50 amino acids. It's made by you. Can't patent it. So there's nothing in the US pharmacopoeia that says I can play with it in the lab. But your patients are saying, I bought this online, it's research-based, and I need some syringes so I can jab my stack into me. Have anybody got one of those patients? Yeah, I play with biohacking, guys. Peptides aren't bad, but we'll talk about why peptides might not be the first or best solution. Dr. Tracy did that. That's the end. That's the icing on the cake, right? But what we're talking about here is from compounding perspective. Just so you know, don't ever ask me to make something because it's cheaper than the pharmaceutical product. It's illegal. I just tell people I don't look good in stripes and orange isn't my favorite color. We can compound things if you don't want fillers in them, if you want to make it hypoallergenic. We talked about all the processed foods. How much junk is in pharmaceuticals? It's not clean. We teach our patients to eat clean, eat veggies, eat whole foods, eat clean meat, hormone and antibiotic free. Well, medications aren't necessarily clean. There's a lot of corn, hidden soy, hidden gluten. Corn goes by lots of names. Does everyone know that? You got to really dig in. So ask me, ask your compounding pharmacist because they can do that work for you. So we can provide medical necessity to make stuff. We just have to know what to say. So medical necessity to compound a commercially available product is needed. This is why you got all the GLP-1s with B12 in them, because it's nausea. What I don't want you to do is have the resonance to skirt around the pharmaceutically available ingredient so you can get it to your patients cheaper. So then you put a tag on it. Go deep with them and just be pure that says, are you experiencing nausea? Or are you sensitive? How many people don't need all these dyes and everything in there? So vegan friendly, anything, just stick it on the script so we can or allow us to help you with that. Make sense? So that's just one tidbit. I get it all the time. Can you make this? Yeah, maybe, but is it appropriate? I'm only saying this, guys, because there's no pharmacists. There's only a couple of you in here. It has to be some evidence for a patient-specific requirement. I'm a 503A. I'm a boutique pharmacy. I don't do a ton of volume. I serve people well. But when you come to me and you give me your prescriptions as an energy exchange, it's not to get the drug dispensed. I think pharmacists are the most underutilized healthcare professionals in the entire country. We're very highly educated. We have doctors behind our name, and we sit behind a counter and people can walk through the door and ask me a question. That's pretty hard these days. But we do more than dispensing. As if you get to know me through this slide, you'll know that, right? So use us for our advantage to give you value into your practice. You guys are all busy. Everyone's busy. Who's not busy in this room? Right? We're busier more than ever. Our stress response system's kicked in all the time. So we've gone through the commercial thing. We've documented medical necessity. We're shifting more towards restricted lists. But we know in February, RFK Jr. said 14 peptides are going from really bad to not so bad. That doesn't mean I can do anything with them yet. I just want you to know, because it's got to go through the regulatory process. But that's a huge step. In July, they're going to be talking about, and these 14 peptides can be very useful. What I want you to know is what I can do with them once we get some clarity around should we, do we have the opportunity? Because what I'm doing in that lab, let's think of it as, has anyone seen Willy Wonka and the Chocolate Factory? Just think of me in my lab there. I tinker all the time. So I'm tinkering with peptides. We're going to tell you a little bit about that. I'm tinkering with these things because it's not the entity itself, it's how it gets in the body, into the cell, into the nucleus, into these things that does the messaging. All right, does anyone else want anything more about this? No. All right. So we got legal standards and clinical distinction. We all got that. Good. That's my boring slide. I don't like that stuff. Look at this beautiful picture, by the way. Is anyone fascinated with the beauty of nature? Sacred geometry, is that something someone really like? I know, so I can just look over here and get validation every time I'm talking because they're all like, yes. But look at this beautiful, this is a liposome. This is what it looks like. And I'm making these simple for you guys. Don't worry about complex here. It's a protective phospholipid bubble used to transport an active ingredient. That's it. Because in the middle of that little bubble is glutathione. It's vitamin C. It's what I'm going to talk to you about. It's testosterone. It's progesterone. And, spoiler, it's a peptide. These have been around for a while, though. If you do a deep dive, liposomes have been around since 1965. Why in the heck haven't we provided more information about this? It was really discovered with chemotherapy and some vaccines way back when, and then it just got forgotten. And then some nutraceutical companies back in the day, 30, 40 years ago, there's some ones that have been doing this exclusively, started using it in poorly absorbed nutraceuticals. Curcumin's a great example. Glutathione's a great example. And I'll go through the little mechanism of why we can skirt it into the system easier, but everything degrades in the gut, right? This is why we never did oral insulin, because it just chews it up. It's a little peptide and it's got amino acids on it. The gut wants amino acids. Thinks of it kind of like a steak. Just pull apart the amino acids and eat them. So we got to bypass stuff to get it in the body. That's the pharmacokinetic side of it. We're adapting it now to hormones. This is the stuff that's been coming up for the last couple years that I've been studying, using, and now ready to deploy. Liposomes and nanoemulsions. They're kind of the same thing. All I want you to look at this is use them interchangeably in the fact that they're little bubbles wrapped around a fat with a tiny molecule in the middle. It's just, what molecule do I put in there? If I say nano, it's a fat-soluble molecule like a cholesterol-based hormone. If I say liposome, it's an aqueous core, so it's a water-soluble thing. Make sense? That's it. So if I say liposome or nano, it's just just think of it as interchangeable because it's a fat on the outside, and that fat is phosphatidylcholine, a medical grade, injectable grade when I compound it, phosphatidylcholine. What is phosphatidylcholine? It's the molecule that's made up of our cell wall structure. So when we do an oral liposome, and we have this little, and it's, to make liposomes right, I won't get into it, it has to be a certain size. So I can't put a big old molecule in here. It's got to be tiny. It's got to have a low molecular weight. Good news is peptides are tiny. They have low molecular weight. Hormones are tiny. They have low molecular weight. So I can't put big old stuff in here and make this work because it has to be less than 100 nanometers small. These are tiny little bubbles to get through the passive transcellular absorption that we're looking for. All I think about now is, how do I make something in this fashion if it's possible? Because what we're going to talk about today is the application of it. That's important. It's the technology that lets us apply it to our practice in a new way, a new method. Think IV done orally. That's as simple as I can make it. These will go in 10 minutes and they're out in 4 hours. They're not going to accumulate in the blood. They don't sit there. They go straight in. So wrap it in, wrap it out. What's the scientific rationale? We have higher bioavailability because it's bypassing first pass. It's going right into the mouth, going through the cells and into systemic utilization. This has been proven with uptake studies with nutraceuticals. This is why you can say 185 times more bioavailable when you use a specific way. But just like the supplements that we talked about earlier this morning, not all liposomes are the same either. They're not going to act the same. They have to be done right. This is why it took me 2 years to figure out. They're fast absorption. They're shorter clearance. So this facilitates effective pulsatile dosing. We'll talk a little bit about that. and reduced hepatic exposure because it's not going through first pass metabolism. We got all that? That's the fun science stuff. We're done. Cool. Look at these beauty pictures.
How much do you really limit it going?
Can you hold your questions till the end? And great questions. So that's the other piece. How can you hold it? What's the dose? Because you got to change your philosophy if it's getting in faster. So not all the science is proven yet, but all the science is applicable because we've seen it. So we can apply it this to that. So just think, glutathione, right? Great example. It's getting in you, and you've seen the clinical results. Is that where I want you to look for? Glutathione is actually a peptide, remember? It's a tripeptide. So you all are using peptides in different ways. NAD, great example. If you do that liposomal delivery, NAD, small molecule. It's not a peptide, but it's tiny. And it gets chewed up. Vitamin C just gets IV levels. So you don't have to do gram doses. And curcumin is one of the best. It's a great molecule. It's good plant medicine molecule here. We're using curcumin in many different facets of inflammation and beauty and all those things, right? There's one brand that has, they're here, their curcumin has 400 times better bioavailability. So they've done the studies, the uptake studies for that. So there's some relative use for us to use these. The body operates in rhythms, does it not? We talked about the cortisol awakening response a few times. High in the morning, curves down. We don't want cortisol when we're sleeping. That's the bad time to run from the tiger. We know this in circadian rhythms with melatonin, the same thing. If melatonin's high in the day, what are we going to do? We got to sleep. We're sleepy. So your body knows rhythms. There's signaling molecules, there's signaling things that go on, but at the end of the day, the body knows what to do. You're not actively thinking about any of this. You beautiful women in the room, you know what a cycle is. I just call it a rhythm, okay? It's easier for a man to call. I'm not going to go to a man and say, you know what, I need to help you figure out your cycle. It doesn't work. There's still a lot of bro medicine out there with TRT. We're going to talk about how it's very different from how I look at it. But estrogen, progesterone, they're all in cycles. They're not only daily cycles. You have weekly and monthly cycles. So now there's complexity within cycles, cycles upon cycles. But did you know that testosterone has a diurnal rhythm? You make it when you sleep, and it surges in the morning because that's when you need it. And it falls during the day. Now, it might have pulsatile days and spikes during the day, but just want you to know that testosterone, too, also has a diurnal rhythm. And that's where I put a lot of focus in my work over the last couple of years because I love men's vitality, but in a different way. And I'll talk to you a little bit about where we are with it. Oh, yeah, insulin has a pulsatile effect in the body, right? When you eat something, what happens? We secrete more insulin. If we did that all day long, what would happen, right? But here's where we were and here's where we are. When I went to pharmacy school, there was no rapid acting human recombinant insulin. It was bovine. Remember, do we ever remember the OTC bovine insulin? It was like $20. And diabetics would come to the pharmacy counter, ask for their insulin without a prescription, and I was just give it to them. We'd pay for it. And it was $20. So that's how we started with insulin. Bovine, some other animal-derived thing. Then biological engineering advancement, the rapid acting and the slow acting came into play. And then in pharmacy school, they talk to you about traditional testing of diabetes. Anyone go to school in the 90s, 80s? Yeah. Well, we were happy if a diabetic tested once a day. And then we started to teach intensive therapy where they were pricking their finger 6 times a day and getting better results because we had to see the pulse, right? And then we got these fun things called CGMs where we didn't have to deal with that anymore. You just look in your thing, right? So this is where we went with insulin. So now what we're going to talk about is pulsatile dosing with hormones. to mimic the same kind of rhythms that are going on in the body. I've done a lot of research and a lot of work with TRT over the past couple of years, because when I had my aha moment, I got in the room with the right people, because I'm a clinical nutritionist at heart. I'm a functional medicine provider and a compounder. So those three things together got me to the first stages of nanoemulsion hormone-based therapy with testosterone. I was taught how to do this. But the aha moment was, okay, what does this mean? What is it? Well, it led me to the problem. What's the problem with TRT in men? Anyone doing TRT, treating males? Lots of things, okay? But I'll go over it with you guys. 30 to 40% of men have an attrition rate with a normalized TRT, whether it's creams, injectables, or pellets. They're super physiological. Did you know that a male in his 20s and 30s makes about 5 to 7 milligrams of testosterone per day? So we got used to dosing at 100, 200 milligrams in the injectables, 150 milligrams or more in the creams and the gels and whatever's, right? Well, what does that do? It triggers suppression of endogenous production. There's no feedback system that says I need to make it anymore. And we know this, right? So poor men, right? Poor us. We have two options when our testosterone is hypogonadal. It gets below that threshold for prescribing. We don't feel good. We all went through today the importance beyond hormones. I love Dr. Sanjay. It's for life. It's a life hormone. And for men, it's predominant, right? Women too, a lot of prescribers. It's my number one compound now is testosterone for women. We forgot that they need some too. So thank goodness. But we got the hypothalamus. I got to read this stuff. It's so complex, right? The hypothalamus releases GnRH in a pulsatile manner. The anterior pituitary stimulates the anterior pituitary to release LH, luteinizing hormone, and FH, follicle stimulating hormone. LH and FSH go down to the latex cells or the Sertoli cells and support spermatogenesis and produce testosterone in the testes. That negative feedback loop, just think of it this way. Do you constantly eat after you eat? Some people do, right? But when you're full, you don't want to eat. There's a mechanism behind why you don't eat. Well, if we give super physiological doses, the problem with this is men have two choices. I go on TRT, I stop making it. This is evidence because my body doesn't make it, and now I'm dependent. This is why we call it hormone replacement therapy. We're replacing what your body does, but in men, they're suffering because now they don't make it. And for a man that might need it in their 30s, and they still want to have babies, not a good thing for the population of the planet, is it? We talk a lot about women in fertility. Did you know that men's fertility is going down rapidly? Good. We got to do something about it. I think this method can help that. Testosterone is going down as a global population by like 1% a year. So we're seeing deficiencies in hormonal balancing in men in very early stages. That's not good. So you either go on it and it's suppressed and you get a super physiological dose, then you crash, and then you get another one and you crash. There's no balance there. Or the other one is you just simply suffer. You don't get on it and you age gracefully. We're hormone doctors here. We don't age gracefully. We want to be vibrant for a very long time. My definition of longevity, I want to feel as vibrant as I possibly can. And when I'm about to get off this plane of the universe and go to the next one or whatever you believe, I want to drop. I want to feel vibrant all the way to the end. That's it. None of this live longer. Our tagline at Stay Well is live better, stay well. Because I want to live vibrant, right? When I use the word for women, it's radiance. Oh, isn't that got your heart going? But now there's no bashing the way we've done it. I don't ever do that. I just say it's not complete. It's not broken. It's not complete. What if? So this is my aha moment. What if I have this technology, wrap it in, wrap it out, da 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 da. What if we could see something different? So this is what the rhythm looks like in the blood. This is a 15 milligram dose of nanoemulsion testosterone, 0 point less than 500. In 30 minutes, this rose to 2,300 nanograms per deciliter and returns back to normal in 300 minutes. So that's what was given to me. What was also given to me is the LH and FSH didn't crash. Ooh. That became the woo moment for me, because now we're not suppressing, and maybe we could turn that R word of replace to maybe restore. So my whole concept here is, if LH and FSH levels remain intact during this nanoemulsion dosing, suggesting the HPA axis continues to function between doses. In other words, make what you continue to make and put that icing on the cake. Restore it back to when you were in your 30s, feeling vibrant like a man and not 70%. That's me in Peru on Rainbow Mountain. That was after my healing journey. I call it my journey to self. It was in 2024. The first slide was Machu Picchu, me walking the Inca Trail. What I didn't show you was, before I did this was my integration. And that's like 14,000+ feet. I made it. I spent 21 days in the Amazon studying and healing with Shipipo healers in the Amazon, in a Maloka, with 23 other people. Yes, plant medicines were there, but I was healing. And I came back a different man. And that's what sparked everything for me. Does the word alignment feel good? Do your patients feel aligned when they come to you? I think it was Dr. Tracy, it was even Sanjay. We all said they come and they're like, I've been to all these doctors, labs look good, but I don't feel like myself. I didn't feel like myself because I was burning. And when I came back on the other side, and I can't tell you how much of a change that was. If you ever want to talk to me about that stuff, either listen to my podcast, because I put stuff in there, or just call me. We'll connect. This is about 2 years ago now. I had this technology. Oh my gosh, I'm an emotional authority. Any human design gene keys geeks in here? Just one maybe? I'm an emotional authority. It's like, I get emotional. And so I was so excited. I'm going to these conferences saying, hey, I have this compound, I can make it. It doesn't suppress LH or FSH, and it's pulsatile. I think we can do something here. What do you all providers do when I do stuff like that? Who's at it? You get a prize. Show me the data. Well, believe it or not, there's not a ton of compounding data out there. We don't have millions of dollars to do all these studies, but you still prescribe them. So what did I have to do? I listened and I said, well, shoot, I got to figure this out. Let me get some data. Because the people that supported this, they gave us preliminary stuff, maybe one guy, but no long-term studies, because you guys are wired that way. I hate the word double-blind placebo-controlled study. Okay, yes, it's necessary. And if I could give less dose and it's in and out, and I can tell you that it doesn't suppress or show that it might not suppress, you guys are integrative. We talked a couple years ago in this room, or whatever room it was in here in Nashville. I talked about like what it felt like back in the day, just being called an integrative provider, and the stigma we all got 30 years ago when you were doing complementary stuff, right? So this was kind of that space for me. So I had to this guy had to stick his finger 6 times in a day to show the rhythm that I showed you, to show that LH and FSH didn't drop. Because what does all mad scientists do before they go to anyone else? They do you. Yes? Now, yes, it was a bona fide prescription. Yes, I finally got to the place in 2026 where my testosterone levels as a man at 51 weren't quite optimal. So I'm N equals 1. What I've found, and I have men in this now, we're building the program. Don't worry, more data is coming. I'm going to get you your data. I want to collaborate with the ones that want to do this with me. There are Charlotte providers in this room doing this with me now. Look, I had to make up my own lab because they didn't have the analytes they needed to do this. So there's a lot of making up stuff. Any entrepreneurs in the group? Yeah, you know what happens. You fail fast, don't you? Because you fail fast so you can learn. Because you're either winning or learning. Being creative. I like that. Curious. I don't know if my wife is going to like that. Hey, honey, I screwed up. I'm just being creative. Trust me, my wife puts up with a lot of me. But what I found is pulsatile. The LH didn't drop. And I also tested my cortisol. But I did it on my kitchen table, okay? And that's my curve. So it worked. Did the same thing. And I got the bonus. The diurnal pattern foil was just nice and fine. I didn't go anywhere. So mine was 5 milligram dose. And I can share my HIPAA-related information because it's me. So here you go. My N equals 1. This is in February. I was at 698. I went to 1389 in, it was like 15, 20 minutes. Wrap it in. Pretty cool, huh? So for the first time, and I did it because I believed enough to do it myself. Do you ever believe in something so much that you just don't know, but you know? We all have, right? How many moms in the room? Mother's intuition. You just know because your mind thinks, but the heart knows. Intuition. It's real. So this is kind of what I've kind of come up with. We want to match real rhythmic dosing. So we got to do data collection a new way. But this is kind of the intensive insulin therapy testing phase. I had to prick my finger a couple times. Not every guy wants to do that. To show that it supports this natural rhythm and does not suppress and doesn't cause issues with the liver enzymes because we want to see it first pass metabolism. It's circadian aligned with this pulsatile dose. I'm working on flex dosing. I'm working how high and how long to do this so we can get to that sweet spot individualized around the non-suppression. The non-suppression is the piece. And it's real-time feedback. But here's the deal. I'm going to give you a little glimpse into the future. You know when you're connected to something and you're really passionate about it, things just sort of align? Does anyone ever, I call them breadcrumbs. Some people call them Easter eggs. They just show up. Sanjay and I got an Easter egg last night. It was a fun one. I'll tell you about it at dinner or something. But when you're aligned, things just align, right? So I'm aligned. I think this is amazing. And I start to get people on my podcast. I start to get things like, hey, I got to figure out new ways of dosing this. In less than a year, we're going to have CGMs for hormones. They're in beta now. They're going to use it. They're going to use it for fertility. But are CGMs now used for wellness? Dr. Tracy said it, right? We use it for glucose management. So I'm pretty excited. Not pricking my finger 6 times a day just to figure stuff out. So this is the future for me. Because if I could do this with testosterone, which I know is going to happen, and it's going to change the way we do hormones. Imagine converting this now to women, you beautiful women. We can start pulsatizing and mapping this out in different ways and using AI to configure it in a different way to make it better, safer, easier, and more you. Because a rhythm is you. We're doing this with peptides. There are actually some available right now in this nanoemulsion liposomal format, bypassing first pass, because peptides, you can't swallow them. The BP 157 available OTC, you swallow 2% gets in the body. We know bioavailability. These are peptides, they're amino acids. Body loves to eat them. But if we bypass, we can get better results instead of just injectable. Who wants to inject something every day besides the crazy biohackers? I don't. And there's other bases that we're working with now in pharmacy and in compounding that are also holding a different way, similar but different, high molecular weight stuff like GLPs. So we're getting oral delivery systems that are moving through the mouth into the system. So there's some positives here, especially with the 503A and moving to a completely different molecule with a different dose delivery. Remember what I said, medical necessity or clinical relevance? My patient does not like needles. That's a medical necessity. I did a whole podcast on making needles less hurty with the person who puts their cap on that numbs the skin before an injection. Why aren't we putting that in our clinical practice? She's a super cool person too. So leveraging these advanced delivery systems to establish defensible, science-backed, legal, and physiological pathway for future of compounding operations. That is the future of medicine for me. This is what I say to people when they start, because that just took me 30 minutes to explain. You guys do not have 30 minutes every time you're in clinic to just sit down with somebody and explain. I tell people, who's heard of ride share? We laugh because it's a part of our daily life now. But what people don't realize is ride share, Uber, actually Lyft was first. Does everyone realize this? And it was Uber and Lyft. So ride share has changed the way the world looks at transportation. Transportation is a big word. This isn't like choo-choo trains anymore. You pick up your phone and you can get picked up just about anywhere now in less than 10 minutes and go somewhere. Maybe I'm spoiled. I live in Charlotte. That's my reality. But the GPS chip that was enabled in the phone enabled the concept of Lyft and Uber to happen. Without the chip, the technology, we would not have had rideshare. So I don't want you to think about what I'm saying today as another better hormone, better TRT, because guess what? Men will fail. And I'll share with you some failures that we've seen along the way because we went straight from injectable to nano, rapid in, rapid out, when the guy was used to so much and is not making any. You guys know when the man is suppressed, we have to awaken the body back up to get to endogenous production. Sometimes it doesn't even happen. This is weeks, months, sometimes years to awaken the body. There's a whole protocol that I'm building out for that. But for the purpose of this, I just want you to understand, imagine getting no testosterone endogenously, all this testosterone up here, and then giving this little blip, blip. What that means is, I feel good for a couple hours, crash. So men were crashing every day. And they're like, dude, this thing sucks. And I'm like, doesn't. We just got the order wrong. It took me these things to figure out because, yes, I'm an entrepreneur and we're going to Mars, not the moon. So the technology of nanoemulsion for hormones enables us to rhythmically dose a man based on his biological rhythms. That's what I want you to take out of this. It's the method of dosing this technology, not the technology itself, that is the game changer here. I got to put a plug in here for the NCIMS meetups. Is anyone familiar with this concept? Is anybody going to them? Not many of you. You want to learn and grow free with good people? Do you all like hanging out in this once a year thing together or the grand rounds? It's fun, right? We speak the same languages. We're a community. We have each other's back. This is why group-based programs work better than one-on-one, because you have each other's back. You can suffer together, you can talk together, and you can share information together. I have a fundamental belief in the well-care field. I'm gravitating to healing now, but it's all the same. If you're in well-care, I don't believe there's any competition. Do you know why? Because this world is pretty dang sick. We're taking more and more medications, yet chronic disease is exponentially rising. There's some fundamental issue with that. And we can talk to our patients about it because that's the outside world. Something gonna fix me, someone, diagnosis, something, drug or pill or peptide or icing on the cake gonna fix me, when we're not talking about the inside out approach as well. Healing starts from within, not another pill. So healing certainly doesn't happen in a bottle. So I encourage you right now, currently, we meet up in Charlotte in my store because it's convenient. It's central to the middle of Charlotte. So anyone in the Charlotte regional area, you're welcome to join us. It's tough. We have RSVP issues. All this stuff is working out. But at the end of the day, we get to meet and we get to learn from each other. So Lindsay's been awesome. We've been working together. We text like, hey, how about this? How about this? We're trying new things to get people to move. A couple hours for your day, 6 to 8 p.m. once a month, is doable if you want to grow. And we have fun. So I envision these things as being little hubs that we can constantly learn. And then we come back to Grand Rounds. We come back to this conference. We share what we've learned and we grow, because this is how it works. And we may not do it forever in Dilworth, but it works for now. But come, if you're in my area, come. I'd love to come to Asheville. Is there an Asheville group here? Do you guys meet? I'd love to come here and meet. Greenville, we've got all these places. The hubs are coming, right? So I encourage you to do these regular meetings. It's professional connections, yes. It's networking, yes, but we learn and grow from each other. I have a lot of provider collaborative initiatives. I call them strategic alliance partners. If there's any hormone doctors in the room or providers that want to work with me on these things so we can move faster and smoother together, great, let's work. Let's figure some things out. Let's collect the data. Let's share. I'm a big fan of sharing what I can share. Some things I can't because there's provisional patents and trademarks and all these things because it's new. But what I can share is what we're sharing, what we can grow together. And I'll have a way soon. You can have a slide and you can scan it. People love QR codes now. I want to give you a certain easy call to action so you don't forget about it, because as soon as this thing ends, if you don't do anything, 80% of you aren't going to do anything. This is why we do accountability. Who's a health coach in here? Or who coaches people through stuff? Everyone needs accountability. It's an 80-20 rule. The Pareto principle is real. 80% of people need accountability. I need accountability. I'm super visionary. I see the future. I'm a seer. The detail work is so hard for me. So I need coaches, because I'm also very, very high D in my DISC assessment and who I am. I need a challenge. You know, the people, so understand your patients and how they need to be talked to, not the way you talk. I need a challenge. I need someone to tell me, I bet you can't go gluten-free for 7 days. I'll go, screw you, I can. But some people aren't. They need to be held and nurtured and say, if you mess up, it's okay. You're perfectly perfect just the way you are. That's my wife. You can see the dynamic shift in our family because we're polarizing in our shadows. But when we're in our gifts, we're amazing because we're very complementary. So let's collaborate more, shall we? Can we agree to that on the way out of here this week? Can we collaborate a little bit more? And if you got some really cool thing going and you agree that ancient wisdom meets modern science for true healing, and you want to de-prescribe medications and make them unnecessary by healing people, and you're doing something fun and cool and interesting and innovative, because I love that stuff, let's do a pod together. I've met so many cool people across the world doing this stuff that I could have never met in my entire life by just doing a podcast and speaking my truth. We're going to hit about 1 million downloads this year. I'm happy for that because that makes me say people want this. They're listening. We're building a Stay Well community online and locally because in response to all those eyeballs listening and looking at things in long form, I love long form. I love talking. I love having conversation energetically with people that are aligned. So for the right person, it's priceless. For the wrong person, it's worthless. So let's do a pod. I do sincerely thank you all for allowing me to be up here, sharing my work, sharing my passion. And I use this phrase in my men's vitality group. We've got a small group of men going through this thing together. It's not perfect. We try to be kind, not nice to each other because we got to grow. We got to stretch. We got to do these things. All that stuff that Dr. Tracy was doing was awesome. It's like we check our Oura rings. We do all the other stuff. We do the lifestyle piece. That testosterone is the pillar. Anyone heard the phrase, sell them what you want? Sell them what they want, give them what they need. How many of you do that in your practice? They buy one thing, they come out on the other side a completely different person. That's called transformation. What's the difference between transformation and change? Anyone want to take a stab at that? Someone have an idea? They can speak up. Emotional growth. So the definition, my definition, the way I see it, of transformation versus change, I'm in the business of transformation. When you transform, you can't go back. Just like a butterfly coming from a caterpillar in the cocoon to a butterfly, that's transformation. Change. So let's get into the business of that. So I'm going to leave you with this. With all that said, the best medicine is inside everyone. You, me, everyone, your patients. Remind them of that. They are their own healers. Anyone know Sachin Patel? He's a brother from another mother right now for me. Like we're on the same wavelength. He's doing something and I go, dude, I'm just thinking about that. Well, he says the doctor of the future is the patient. And I say the pharmacy of the future is inside of you. We literally can make a pharmacy of chemicals by thought. Dang it. This slide deck did have a QR code on it. So I guess the universe did not want me to have it. I can send it to Lindsay. She can send it out. The QR code is simple. I wanted you to scan something to get to me in a different way. I'm multimodal. I have lots of things going on. What I want you to know is if you're interested in anything, you want more information, you want to collaborate, I'm starting an Ancient Wisdom Meets Modern Science workshop here in Asheville on weekends with a post-tribal shaman who's been studying shamanism for 30 years and bringing ancient wisdom and modern science together. You're interested in stuff like that? I want to give you an opportunity to just connect. That's it. You can find me on Twitter, all that other stuff. Josh@gobeyondthepills.com is my email. If you email me, I may not get to you for a while. There's lots of emails in there. So that's why I wanted to give you the form, okay? So with that, there's one thing left. You got a minute, right? This is me. I hiked the Short Inca Trail on my way of integrating my whole journey. For 9 days, I hiked through the Andean mountains. And the Quechuan people in the Andean region of Peru, they have this word called Aini. And Aini means sacred reciprocity. And that word is very important to me because that also means community. So the sacred reciprocity that I'm asking you all of is the energy that I give also can be received, because energy just doesn't get made up. It's received, right? It can't be destroyed or made up. It's all there. It's moving. It's always moving. So do connect with me when you get that QR code. Tell me what you're interested about so I can help you in whatever way it works for you, whatever's aligned with you. And in return, that energy exchange back, maybe I can help you in your patients with compounding or whatever, because we're all in this together and together we grow. So thank you.
Thank you so much. Great. Thank you.